Hello, I am Dr. Rashmi Chaudhary, the Senior Obstetrician and Gynecologist in Cloud9 Hospital, Bellandur, Bangalore, as well as the Shajapur unit I am taking care. My area of specialization is the management of high-risk pregnancies and endoscopic and all the complex gynec surgeries. In day-to-day practice, we come across the women who come for the normal delivery or the cesarean sections. A very common questions what they ask that, doctors, what are the signs and symptoms of labor, pre-labor, how we can identify that we are very close going towards the normal delivery, or what are the signs and symptoms, what are the risk and complication, how soon we report to the hospital. So in this video, we'll be trying to solve all your myths and queries. Normal labor is a series of complex events that happens in the female genital tract in order to expel the baby into the outer world. So there are a series of events. Suddenly it doesn't start. There are many things, changes in the body which happens, which a woman has to identify, and they have to be little more vigilant about that. And these series of events can lead to intermittent contraction, blood mixed discharge, lot of backache, all these things will be there. And slowly the woman will progress towards the normal delivery. So we are trying to solve all these queries in this video. It's very difficult to predict that how close to your delivery time, because each and every woman has a different labor pattern. It is not a very predictable, that is, there is a hard and fast rule that okay, you will have these symptoms, then only you are close to. But there are certain signs and symptoms, 3-4 signs, which you have to keep it in your mind, which will tell you or which will help you in identifying that you are very close to your delivery time. One of the most important thing is the painful uterine contractions. If you are getting the tightening of the tummy, this is associated with the pain, severe pain. The pain starts from the back and it comes towards your tummy. Your tummy becomes tight like a stone, and these contractions are coming at every 10 to 15 minutes interval and lasting for 30 to 40 seconds or maybe 60 seconds. Slowly these contractions intensity increases, but the duration will intervals will be lesser. Then this is a normal labor contractions. Another sign could be a blood mixed vaginal discharge, which is called SHO. SHO is that you will experience that there is a slimy mucus kind of thing which is coming, which is mixed with the blood, and you are experiencing it. This is called SHO. This SHO is because your cervix is trying to open up, so some of the cervical gland and the blood vessels, they are sheared away, and this is a sign that you might be heading towards your delivery time. Yeah, very close to that. The another thing that there can be rupture of membranes, water bag will break away, and there will be gush of liquor through the vagina, and once it happens, it won't stop. It will keep coming. There will be trickling of fluid. If you are lying down, the bed sheet will be wet. If you are standing, the entire dress will be wet. If these signs and symptoms are there, please report to the hospital. You are very close to delivery time. A woman should understand that they should be knowing that what are the silent signs of labor. Means you are not in labor, but you are heading towards that, and these symptoms can be present maybe 2-3 days prior or maybe 5-6 days prior to the initiation of the labor. So what it will be like, you will be having a Braxton Hicks contractions, which are the painless contractions, but it will be coming very frequent. Okay, and it will be painful, but the pain will not be very consistent. It will just last for a few seconds, 10-15 seconds. It will go again, it will come after 1 hour, 2 hours, sometimes 5-6 times in a day you will be having these symptoms. Then this is not that regular contractions. It will be coming at a very infrequent intervals and with a very low intensity. You might experience at the same time increased vaginal discharge, like the vaginal glands and the cervical glands will secrete more mucus, more fluids. You might experience that there is a constant backache, and there will be tendency for you to go to loo multiple times. You will feel that you are having increased frequency of urination. You might be confused that okay, might be urinary infections like that, but it is actually the baby head is trying to negotiate the pelvis and it is putting a pressure over the urinary bladder, and you are having that symptom. or there can be increased frequency of going for the bowel movements, means you will feel that multiple times you have to go to pass motion. All these symptoms predicts that you are in an early pre-labor status and you will go into labor very soon. Normally, the women, they ask what will be our feelings once they are coming for the antenatal visits and all. They'll ask this question that what will be my feeling and how we will feel it at that stage. So normally a woman feels very light at that 3-4 days prior to the delivery time, because the fundal height at 36 weeks, the uterus is exactly near the xiphi sternum, which is the bone in your chest, and you will be having lots of discomfort in the upper tummy. So as you are heading towards your delivery time, your baby head will try to sink down. It will try to go down in the pelvis. So you will feel very lighter. Upper part of the tummy will be a little light. You will not be having that much discomfort in having food and all, and it will be quite lighter. But at the same time, you will have an increased frequency of urination, because the baby head will settle down in the pelvis, and you will have some sinking effect, that as something is moving down in the pelvis. This is a very common symptom, that I feel something, some lightening kind of thing, that patient will feel that something has moved down, some lightening kind of feeling will be there, and this is very common what you are feeling 2-3 days prior. Or at the same time, you might feel the increased vaginal discharge, and off and on slight spotting can be there during this period. It is often asked that can my labor start suddenly? It is very difficult to predict that you will have a long latent phase or your labor, but many times the labor